To introduce our first speaker, who is Jessica Nunez Ybarra, is the Community Health Medical Administrator from CDPH in the Office of Policy and Planning. Probably there is no one in CDPH more dedicated, more passionate about preventative care for that. And she has been an ardent supporter of right care, and we're proud to introduce Dr. Nunez at this time.
Thank you so much. I'm so honored to be here, and I'll make my comments brief. I'm here mainly for you to know who I am. We at the California Department of Public Health take our work seriously. Right now, our strategic aims are that we intend to be a healing, learning, impactful organization. We've taken to heart trauma responsive leadership. We know what comes ahead in the coming years as a result of some of the infrastructure we've had before coming undone at the federal level. So what I'm trying to share with you are some really quick notes, and again, to have you understand that I'm here. Many of us are here. We're going to depend on collaborations like this one more than ever, as funding and resources are harder to find, and people and communities need more support, essentially. I do want to let the group know that information, as you've received in this very nice presentation this afternoon, is key to being able to have impact. And without the information and the data flow, it's really hard to measure how we're doing. So a couple things in terms of data. I want to just thank everyone on this call who was part of our task force at the department. We brought together some really prestigious leaders that were part of our California Heart Disease and Stroke Prevention and Treatment Task Force. Dr. Baumer was wonderful in sharing it. Hattie's a member, others on this call are members. We've received your finalized report with recommendations across various goal areas. Obviously, all this new information and the commitments we've seen today are very important to put out to the masses, to the world, about the concerted effort and the strategies that work. So more to come in the coming months. I want the group to know I've met recently with the Chief Medical Officer of the California Emergency Management Services Authority, and he wants to partner with the group. We will be having an advisory. Hattie and Bill, I am looking to schedule the advisory at the end of October, I think, and I've sent you some dates that might work, but anyone on this call is welcome to join. We need experts like you. We need people that can put into practice what we think would work and would be important. That being said, I want the group to know in terms of data flow, the department will be in the coming weeks and months hiring a chief data officer, a chief epidemiologist. We have a new director, Erica Pan, who's an infectious disease pediatrician, who's basically a hero in many of our eyes because she helped the state survive COVID along with many of you in the trenches. And we have really ambitious ideas. In our effort as the department to combat misinformation, what we've heard from the public is they don't really want any more negativity or threats or discouraging statistics. They want hope. So I'm very pleased with what and how Hattie opened up this presentation with a song, with joy. That's what we're going to need moving forward for people to really listen. It's hard times for sure. We know that Medicaid's going to take a hit and all of our healthcare systems are going to have real difficulty. We know physicians are burning out, but it's networks like this that keep us going. We at the department and the Office of Policy and Planning are working very closely with the University of California and others on academic partnerships to really make sure our students also have a pipeline for job opportunities and that we think about the research that we will need. Guidelines such as those that you're describing today are very important to keep sharing with our experts and with the public. So I just applaud the very brilliant overview and the prioritization as has been outlined. And again, I'm Jessica. I'm here for everyone. I couldn't be more happy. And at this point, I will let you also know that the department, our cardiovascular disease prevention program, is committed to promoting the American Heart Association's Life Essential 8. But we have other ideas, and one of the people who's going to be helping me on the report that I described earlier is Dr. Amparo Villablanca from UC Davis, again, Dr. Balmer and others, and Dr. Hernando Garzon, who again is the Chief Medical Officer at EMSA, and I'll have more updates through Hattie. Thank you so much. That's my time and my commentary, and appreciate the opportunity to share this news with you.